Hi everyone, this is Joseph, United Aesthetic, Skin Perfect Brother. I want to tell you a story. So if you zoom in, this patient was concerned about her eye region before. This is before she had any treatment done. Went to a place where they placed a filler into the eye and actually give her a little bit more bump here and some hollow. So what we did today was kind of smooth this region out. And we chose Sculptra versus HA product because Sculptra is liquidy, it's a biostimulator, and the liquid, the particle will kind of go from the bottom and filter up to the surface to fill in all this region. She'll need about 3 vials placed deeply in this fashion in the deep compartment region. And then we put a little bit on the surface. So deep, then come back and do a little bit surface. Recognizing there are a bunch of structure here. Here's the angular artery. There is some of the facial artery. It actually comes right here. You have the inferior orbital bundle. You have the facial vein right there. So injecting the proper layer will ensure results and safety. So our first time client, she came in like this. And she's walking away like this, lot smoother. So we can fix people's issues. Come see us. Take care. Hi, so we're treating this region to improve her laugh line as well. Previously, she had some filler placed. I think it was, first time is a good product, but I guess for here, probably was placed too superficially, causing this edema right there with a little groove. So we're gonna use Sculptra in the deep plane, and we're gonna enter here through cannula, and we're going to put in a deep plane to help her right here. And the audience should see instantly that with Sculptra, it takes about 3 months to grow, but she'll look pretty nice today because of the hydration in it. And after a few weeks, it'll go down, which is normal, and then she'll come back for a little bit more Sculptra. So fixing other people's work is always a bit more difficult, but we could do it here. We chose Sculptra to fix this because it's liquid. It kind of goes from the bottom up. Look, a little pinch. Using it, I'm gonna be using a 25 gauge cannula right here. I just used the pilot needle, and I'm gonna insert the cannula. As you can see, it's getting a lot smoother because the liquid is filling up all the spaces. So I'm putting some of the resto space from this approach. It's right here. I'm gonna lift her nose, open her mouth so she can breathe. And I'm gonna locate the, which is right here underneath the facial artery, the angular artery. Go ahead and smile.